A medical interpreter plays an essential role in bridging the communication gap between healthcare providers and patients who speak different languages. Their work ensures that patients fully understand their diagnoses, treatments, and care instructions, while helping medical staff receive accurate information from the patient. Because of the sensitive nature of healthcare communication, a medical interpreter must demonstrate linguistic precision, confidentiality, cultural awareness, and emotional composure. In this guide, we'll explore some of the most common medical interpreter interview questions, with structured answers and helpful tips to help candidates present their competence and professionalism confidently during interviews. Understanding the role of a medical interpreter. The role of a medical interpreter goes beyond simple translation. It involves accurately conveying not just words but also the tone, intent, and emotional nuances of each conversation. A skilled interpreter facilitates mutual understanding while maintaining neutrality and confidentiality. They work in hospitals, clinics, and other healthcare settings, where accuracy can directly impact a patient's well-being. Employers seek candidates who are fluent in both languages, familiar with medical terminology, and capable of handling high-pressure or emotional situations calmly. Preparation for an interview means demonstrating strong communication skills, ethical judgment, and cultural sensitivity. Whether assisting in a routine checkup or an emergency, a medical interpreter must ensure that every message is clearly and faithfully conveyed, preserving the integrity of patient care. Question 1. Why did you choose to become a medical interpreter? Here's how you can answer. I chose to become a medical interpreter because I believe language should never be a barrier to quality healthcare. Helping patients communicate their needs and understand their treatment brings deep satisfaction. I enjoy using my language skills to make a meaningful difference in people's lives while supporting medical teams in delivering safe and effective care. Tip: emphasize empathy, purpose, and passion for communication in healthcare. Question 2. What are the most important qualities of a good medical interpreter? Here's how you can answer. The most important qualities include accuracy, confidentiality, neutrality, and compassion. A good interpreter must remain impartial, convey information word for word without personal interpretation, and handle sensitive information discreetly. Compassion is also vital because healthcare conversations often involve stress or fear, and a calm, respectful tone helps everyone feel supported. Tip: balance professional traits with empathy and emotional control. Question 3. How do you ensure accuracy during interpretation? Here's how you can answer. I make sure I'm fully attentive to every word and context. If a medical term or phrase is unclear, I ask for clarification immediately rather than guessing. I also stay updated on medical terminology in both languages and maintain glossaries for common procedures. My priority is to ensure that both patient and provider understand each other completely. Tip: show a commitment to precision and continuous learning. Question 4. How do you handle situations when you don't understand a medical term? Here's how you can answer. If I come across a term I don't understand, I politely ask the speaker to clarify or rephrase. It's better to pause briefly than risk a wrong translation. I take note of the term afterward and research it so I'm better prepared next time. Accuracy always takes priority over speed. Tip: show humility and a responsible approach to unknown terms. Question 5. How do you maintain confidentiality as a medical interpreter? Here's how you can answer. I strictly adhere to confidentiality policies and HIPAA guidelines. I never share patient information outside the interpreting session and avoid discussing cases with anyone who isn't authorized. I understand that trust is built on privacy, and maintaining that trust is part of my ethical responsibility. Tip: emphasize understanding of confidentiality laws and ethical boundaries. Question 6. How do you manage emotional or distressing situations, such as delivering bad news to patients? Here's how you can answer. In such situations, I maintain professionalism and empathy while focusing on accuracy. I remind myself that my role is to facilitate communication, not to comfort or intervene emotionally. However, I always ensure that my tone is calm and compassionate, helping to maintain a respectful atmosphere during difficult conversations. Tip: Show emotional resilience and professionalism without detachment. Question 7. Can you describe a time you handled a challenging interpretation session? Here's how you can answer. In one session, a patient became upset after receiving complex medical information. I stayed composed, interpreted every statement clearly, and allowed pauses so both sides could communicate calmly. Afterward, the doctor thanked me for keeping the situation balanced. That experience reinforced the importance of patience and emotional control. Tip: choose examples that show calmness, empathy, and focus on accuracy. Question 8. How do you prepare for an interpreting session? Here's how you can answer. I prepare by reviewing any available patient information, confirming the language pair, and familiarizing myself with potential medical terms relevant to the visit. I ensure my equipment, like headsets or notepads, is ready if needed. Mental preparation is also important, so I take a moment to focus before starting. Tip: demonstrate organization, readiness, and attention to detail. Question 9. How do you handle a situation where a patient prefers to talk directly to you instead of the doctor? Here's how you can answer. If a patient directs questions to me, I gently redirect communication back to the provider by saying something like, "Please tell the doctor what you just said, and I'll interpret it for you." This maintains proper communication flow and professional boundaries. My role is to facilitate, not participate in, the conversation. Tip: show respect for professional roles and ethical clarity. Question 10. How do you deal with differences in cultural understanding between the patient and provider? Here's how you can answer. I'm careful to interpret language accurately while being aware of cultural nuances. If a misunderstanding arises due to cultural differences, I may briefly explain that a phrase or behavior has a specific cultural meaning, but I never alter or filter messages. Cultural awareness helps prevent miscommunication and builds mutual respect. Tip: highlight your sensitivity to culture while maintaining neutrality. Question 11. How do you handle fast-paced medical settings like emergency rooms? Here's how you can answer. In emergency settings, quick thinking and clarity are vital. I focus on active listening and short, accurate translations to keep communication flowing efficiently. I stay calm under pressure, prioritize essential information, and adapt quickly to the team's rhythm while maintaining accuracy. Tip: emphasize adaptability, focus, and composure under stress. Question 12. Why should we hire you as our medical interpreter? Here's how you can answer. You should hire me because I bring linguistic expertise, medical terminology knowledge, and a deep commitment to ethical and accurate communication. I understand the responsibility that comes with this role and always strive to ensure that patients receive the best care through clear understanding. My calm demeanor, professionalism, and empathy make me well suited for high-pressure healthcare environments. Tip: summarize skills, ethics, and passion for the healthcare mission. Final thoughts. A medical interpreter interview focuses on your communication abilities, ethical awareness, and composure in emotionally charged situations. Success in this field requires much more than bilingual fluency. It demands empathy, confidentiality, and cultural sensitivity. Every response you give should reflect your understanding of these core responsibilities. Employers value interpreters who can remain impartial, accurate, and calm even when faced with urgency or distress. Showing that you care deeply about patient well-being while maintaining professional boundaries will make you stand out. Ultimately, a great medical interpreter is both a bridge and a guardian of understanding, someone who ensures that every voice is heard clearly and every message delivered faithfully. By preparing thoughtful answers and demonstrating your compassion, focus, and integrity, you can confidently convey that you're ready to uphold the highest standards of communication in healthcare.